Hi everybody, welcome back to Heart Attack Rehab. Today we're going to be talking about the drugs that were prescribed. We should know how they interact with us and what they're doing and what they're for a better recovery. Today Leah is going to be talking about that, giving us the information that we need to know. So take it away, Leah.
Hello. Thank you for having me again, Steve. Today, I would like to talk about your heart attack medications that you may have been prescribed. Your heart attack recovery will include medications. Taking these medications exactly as prescribed is one of the best tools at your disposal for avoiding death in the months following a heart attack. According to an article published in Circulation, the Journal of the Canadian Heart Association, heart attack patients who had not filled any of their prescriptions within 120 days of being discharged had 80% greater odds of death than those who had filled all of their prescriptions. So please note there is proof that you need to take these medications to prevent another heart attack or death. So here are some of the medications that you're likely to be prescribed after a heart attack. Antiplatelet agents, they prevent blood clots and keep the stent open. Examples include aspirin, clopidogrel or Plavix, prasugrel, trisagelar, that's a tough one. It's critical that these medications not be stopped without checking with your cardiologist, because if you do stop them prematurely, it can result in another heart attack from your stent actually closing abruptly. We also have our statins. These lower our cholesterol. I'm personally on rosuvastatin, as I have hereditary cholesterol issues, and I also would like to prevent a heart attack. So examples of our statins are atorvastatin or Lipitor, rosuvastatin or Crestor, and pravastatin. The key tip in that one to recognizing if it's a cholesterol lowering drug is if it has statin in its name. There's also beta blockers. These treat high blood pressure and decrease the incidence of abnormal heart rhythms. They can also help the heart remodel and improve heart function. They decrease the amount of work that your heart has to actually do. Beta blockers after a heart attack have increased survival rates. Examples of these are metoprolol, carvedilol or Coreg, atenolol, and bisoprolol. Lol. It's just lols, lots of lols. Then we move on to ACE inhibitors, or angiotensin receptor blockers. These also lower blood pressure. They can help the heart remodel as well and improve heart function. Some of the examples of ACE inhibitors include Prinivil, Zestril, Ramipril or Altase, Catropril, Valsartan. Then let's move on to the calcium channel blockers. These reduce blood pressure and control the amount of calcium that enters the heart and arteries. This will then allow blood vessels to relax and reduce the workload of the heart. Verapamil is an example of one of those. Nitrates. Nitrates, these are, everything is important, but the nitrates are something that's going to provide more immediate relief. So nitrates expand the arteries that lead to the heart and relieve chest pain. Examples include sublingual nitroglycerin, and then there's also, which is a spray that you would spray onto your tongue. And then there's also patches that you can apply to your skin to release a slow dose over time. Anti-anginal agents, they relieve chest pain also. So besides nitrates that we just spoke about, these also may be given to reduce chest pain. Anticoagulants, they reduce the blood's ability to clot. If there is evidence of a blood clot in the heart after a heart attack, then warfarin or Coumadin may be used to eventually dissolve the clot. If there is evidence for a certain type of abnormal heart rhythm, then depending on one's risk for stroke, warfarin or Coumadin, Pradaxa, or rivaroxaban or Xarelto may be prescribed to thin the blood and decrease the risk for a stroke. You don't want that clot. Then we have to move on to medications that protect our stomach. All of the medications that I mentioned that we were talking about could have a very difficult time with your stomach being digested, etc. Because a heart attack is stressful, and subsequent medication regimens to keep the stent clear often include aspirin or other antiplatelet agents. This can be tough on the stomach and increase the chance for bleeding from the stomach. Your cardiologist may recommend medications to protect the stomach, and these examples are, they belong in the H2 blockers, such as Tagamet, Pepcid, and Zantac, or a proton pump inhibitor such as Protoxin or Pantoprazole. That's a more common one. Because we need to take these medications to keep everything else happy, we can't forget about our stomach. If you're not taking a medication to help protect your stomach, like I said, you can end up with the bleeding, end up with ulcers. If something like that is occurring for you, what you'll see is in any vomit or in any bowel movements that you have, it actually will look like coffee grounds, and that's digested blood. So if you vomit or have a bowel movement and it's just coffee grounds, please go get some help. Okay, this is digested blood that has come from your stomach that you've digested through your intestines and has come out through your feces. It's a good sign of bleeding in the stomach. You'll also have a lot of other side effects that you're experiencing. Your stomach will hurt, you'll feel nauseous, etc. So there are a few warning signs, but please, the general idea behind this particular chat was that we need to fill these prescriptions to have continued relief to prevent death from happening after we've had a heart attack. They all serve a purpose, and you'll work closely with your cardiologist and explain any symptoms that you're having. They adjust medications where they can. The biggest part is to fill your prescriptions and take them. Thank you.
Thank you, Leah, for all that information. I'd have trouble with some of those words too. They're pretty tricky. But it's also very important to understand the medications you're taking and what they do so you can, have a better recovery. And how important it is to take the drugs. I didn't know it was that important, but obviously they wouldn't be giving it to you just for fun, but that's a pretty high percentage of people dying because they didn't take a couple pills. So I hope everybody's learned from that. Come back for our next episode. And if you liked the video, give us a like and subscribe. We'll see you next time.